Hello and welcome to
Hello everyone.
Bear Care Corner. We are here.
Oh, there it is.
We're here at the medical station in the medical suite. It's our caregiver station behind us.
There she
All
is.
the magic happens where we prepare so many medicated peanut butter tortillas,
all the tortillas, all the
all
wraps,
the Fig Newtons stuffed with slippery elm and all kinds of
glucosamine, antibiotics, all of it.
things.
Yeah.
A lot of prep goes on here. We have our big computer screen. What's that for?
Yeah, so this is quite new, actually, this new screen because our old computer broke. But we have basically a giant Excel document that it's called the Daily Animal Care Notes. So that goes over every single treatment, monitor, feeding, everything for all the residents. So it is like, literally, it's like I don't know what to call it, like the heart of the sanctuary. It's the heart of everything.
Yes. When you come in on shift, you know exactly who needs what meds, what happened the day before, what happened the month before.
Yeah.
Everything's there, any changes.
Mm-hmm.
We also have the database where all that information is stored
Like
long
long-term,
term, but this is
yeah.
very much in the moment. There's a tab for every single day. We open that tab and we can see what happened the previous night, like what happened last night.
Oh, Diablo.
Yeah.
I was like, oh my gosh, what happened? Oh yeah, that's right. So it was my weekend, so today was my first day back. So I opened up the laptop this morning and I saw a note from Chris that Diablo had a little wound on his neck. A little abrasion. And Chris, because at that point when Chris noticed it, it was kind of towards the end of the night, so it wasn't really a all hands on deck kind of situation, but it was a very superficial wound. So Chris was able to just give it a quick assessment, realize, okay, this is not an emergency, just going to give it a little spray and kind of carry on with my night, but for the next crew to check on it in the morning. So we took a look this morning. It was a lot bigger than I thought. I would say. I pictured something.
I don't know how it happened.
Yeah, but it's fine. It's just a big, long kind of scrape along the side of his neck.
Some hair loss. And
yeah,
a little bit of blood, but nothing too much.
Yeah, maybe scratched something outside. I was going to go take a look in
that
me
pasture. I don't know anything that's sharp in there.
Yeah,
I could see George swiping him.
No, it seems very like kind of jagged, like it would have been like the edge of something like wood or a corner of a stall or something. I'm not sure. It's not really like the kind of typical injury that we would see on a goat anyways.
That spot too.
Yeah. So we took a little peek at that because Chris left that note last night.
Each other notes.
Yes.
Sometimes it's just good morning and sometimes it's like, hey, check on Diablo first thing.
Yes.
That is correct. Do not accept peanut butter sandwiches when you come to the sanctuary because they will be laced with all kinds of things.
Yes.
Hi, Mary. Hi, Jerry Lee. Hi, Gail. Thanks for tuning in. This is Bear Care Corner. We're just going to give you a few updates kind of within the last few days. Last week, I guess.
Yeah.
We have Richard. We have Robert. We have April. We have Winifred. And that's everybody's update. And we're just going to show you a cute picture of Ray at the end.
Just as a little bonus update.
Why not? We were trying to find him have him in the episode, but he was unavailable.
Yeah, I did check. Maybe I should have tried to schedule this in earlier with his secretary.
He's not aware of this time slot. He knows when Barnside is, but he's not aware of this time slot for Bear Care.
Yeah, shockingly. But
Bailey has arrived for shift. Bailey's on PM shift, so the caregivers switch out, and then when they overlap, we do something called teamwork time. What are we doing on teamwork time today?
Hercules is getting into the shoot. He's a little bit overdue.
Bailey's going home.
Yeah. So Hercules is due for a hoof trim. Get in there. Read your notes.
Real life. This is how Bailey started her shift. Gonna read the notes.
Wow, front and center. Yeah.
Just have a look at the notes.
Oh, that works out perfectly.
There you go.
So Hercules is due for a hoof trim, and he does have a couple cracks on his front feet that we've been monitoring for couple weeks, maybe even
slash his whole life.
Yeah,
the worst ones are.
Yeah, they kind of evolve. We work on them, Dremel them out, smooth them out as we can. But he seems a little bit less comfortable than usual the last couple days. So we're gonna get him up, get a good trim, take a look at what we're dealing with. So I'm sure he'll walk over to the shoot and be a perfect little angel.
Yes, he did the first time. The shoot setup's different here at this property. So when we first brought him over a month and a half ago in the new setup, he walked right in because he didn't really know what's happening.
Yeah.
Once they start to associate, okay, go in this stall, that means I'm going in the chute. Some of them refuse to go in. So hopefully today, again, he'll kind of forget. As long as we keep putting Fig Newtons down, and as long as his mobility is okay, we're increasing one of his meds. So if he's too sore to come over today, maybe we'll give him a few days on the higher dose of one of his meds and do it then. But that could give them a bit of relief. We're assuming there's arthritis in there and all other kinds of things.
Yeah.
Sadie just showed up too. Everybody keeps coming out of the break room door.
She was having a really good nap
Yes.
this morning.
Yeah, she often disappears through the day, and we don't see her for a while. She's hanging out in the old barn, and you know, she just woke up, so she's kind of like.
But she had a good nap inside the break room.
Hi?
So it was nice.
She doesn't always like to get picked up. I want to pick her up.
She's waking up.
Come here, Sadie girl.
She coming?
You woke her up.
She's suspicious.
Oh.
She's standing like right underneath the tripod.
That's
I'm not going to try
very
to grab her. Thank you. Positive affirmations for her. He
Yes,
needs,
absolutely.
Yeah, he's been more sore this past week, and he's been kind of down about it. Like he's been kind of depressed.
He's
as I would
really
call it.
sensitive. Yeah, you
He's
can
very
really
sensitive
tell.
to begin with.
Yeah, little guy.
Yeah. Hi, Laura Jean from Peterborough.
Nice.
Okay, we're going to get into the actual program. Bailey's prepping meds. Like we were just talking about, everything revolves around tortillas, peanut butter, loaves of bread, Nicole's favorite.
The essentials.
I have placed an order today, I think.
Yes, I was going to let you know that I took the last loaf of bread out of the freezer.
I felt
was like,
it.
don't
I
panic,
had this
Nicole.
feeling it was time to do another big bread order.
Yes, we go through a lot for meds.
Okay, so this is something Nicole discovered this morning.
Yes.
A little bit gross photo, but we'll explain what it is. And this is Richard.
Yes, I was doing Richard's health check this morning. It looks pretty wild in this photo. So one of the things that we check on the health checks for birds is their preen gland. So you can't really tell, oh, she's here.
For a second.
You can't tell where this is on his body in this photo, but basically along, like down at the bottom of their back, the chickens at the base of their tail, they have a preen gland. So that basically secretes oil that when the birds are preening, so when they're doing like being very cute and kind of going backwards and grooming themselves, they get the oil on their beak, and then they use that to kind of distribute the oil along their feathers, keep them clean and shiny.
Waterproof.
Yes. And yeah, the duck preen glands are very large and greasy, the big yellow ones. So this is not a normal preen gland. Basically, that round red bulbous thing at the base of the preen gland should not be there. Normally, it's kind of just that little like cone shaped.
It's like a bit hairy looking.
Yeah.
It's hard to explain.
Yeah. So it looks like there might be a little bit of impaction, like maybe abscess. We have like very rarely, because we were looking at preen glands all the time. We were talking about it earlier you'll look at 1 million and they'll be fine, but then once every couple of years you're like, whoa, what's that? So it might be impacted with some oil or dirt or something.
Yeah, that can happen. It's an oil gland, and those can get backed up. So
Yeah.
It could be what's happening.
Yeah, little guy. He didn't seem too sensitive. Typically, they don't really like being touched back there that much, but he didn't seem like more sensitive than usual. So probably this afternoon we'll do a little warm compress on that area for maybe 5-10 minutes and see how he tolerates that. And hopefully that'll help kind of loosen things up, and maybe it'll burst on its own, or we might have to lance it. I'm not sure, but
See
I'm
if
not.
he needs antibiotics.
Yeah.
We're not sure what's going on yet.
Yeah, I'm not wanting to do anything too crazy quite yet, but we'll start with a warm compress and go from there. So yeah, a little surprise on his health check today.
Yeah, one in a million.
Yeah.
Welcome, Charles, who just tuned in from the States. Okay, so that was Richard's update. That's his preen gland update. Next, we have a Robert update. I think we mentioned him a little bit on Barnside, and this is, which one should I do first? The tooth or the
tooth?
This is Nicole's hand because she finds all the teeth around here.
I don't know why. It's like the 4th or 5th one this year. So we found that tusk in the middle of the arena. Basically, you walk, there's like a human walkway down the middle of the arena, April's family on the left, Sammy's family on the
big
right.
hallway.
Yeah.
Drive the tractor in there.
Yeah, quite large. So I found that on the ground, and at first I thought it was from like Hercules or Brindle, but very unusual to just find a broken pig tusk like that.
And not far out. It's like it like got thrown out
The
of
fact
his
that it like
face.
ricocheted that far away was pretty wild.
It was closer to them than it was
Yeah, it was
Sammy's
closer to
herd.
April's family, exactly, which is why we checked there first, but it didn't come from Hercules or Brindle, so eventually we found out it was from Robert. So it's his bottom left tusk. It was a little bit of a jagged break, so when we first started cleaning out Robert's mouth, there were 2 little tooth fragments left, but as of this morning, you saw it here first, everything is almost completely gone. So The one jagged piece of tooth on the left of this photo, or it was on the left of this photo in that hole where the tusk was, that's now fallen out. And then on the right side where there's the more blood, there underneath the blood, there is still a small bit of tusk fragment there. It's very, very loose, so I suspect it'll come out really, really soon. There was more last week, so I was happy to see this. There were those two bits.
Progression.
Yeah, exactly.
They do need to come out. We didn't really want to do a sedation. And
Yeah.
Like, you can't just pull them.
Yeah,
Be
exactly.
very sensitive and never let us look in his mouth again.
Yeah, exactly. I really thought that I could have yanked it out last week, but there was like just like a little bit of ligament holding on in there. I'm like, okay, I think this is going to loosen up soon. So he's doing well, and honestly, all things considered, he did tolerate the flush pretty well this morning. He's definitely not as tolerant as Raymond was when he had his dental issues.
Perfect.
Yeah, but he's being pretty good, and like all things considered, it's
Sure.
not super sensitive. He is on pain medication, antibiotics as well, so he's doing good. So that's good progress. I was happy to see that stuff start to come out.
Yes, and we have no idea what happened. There was no indication.
Yeah.
It's pretty rare for a tusk to break.
But if anything, we've seen broken top tusks more often than bottom. I
True.
feel like a couple of the boys
I think
in Sammy's herd.
He had his top when he got stuck in a fence.
Yeah,
on the gate.
Ted, one of his broke off when he was on stall rest. Remember? I remember Meadow found it,
And we don't know how.
No, we don't know how either.
And on stall rest, like he's not doing anything.
Yeah. So I've definitely seen a couple broken top tusks, but not bottom, which was interesting. So yeah, I don't know how it happened, but he's doing well. Yeah.
Thank you, Laura, who's ordered some popsicles for the cows. You can head over to happilyeverafter.ca. We're doing a little fundraiser with our kindness cooler, and you can donate some fresh, cold treats and different things to the residents because it is relentlessly hot this summer.
This summer is wild.
Like we're sweating right now.
Yeah, it's like 30 degrees Celsius every day, basically.
Yeah. And for the foreseeable future, like looking into the
Yeah.
weather coming up. Residents are doing well.
Yeah.
It's tricky to work in.
Definitely. Yeah, we can't go quite as hard, with, resident movements, hoof trims, handling that sort of thing. We try and keep those to a limit at the hottest point of the day. All the stuff we always talk about, making sure everyone is staying cool, fresh drinking water, bogs, all that stuff. But yeah, it's been a wild summer,
Yes.
very hot, and really bad air quality too.
Yeah, air quality's horrible yesterday, today, and probably for the rest of the week.
Yeah.
Residents are handling okay. I'm noticing a few of the pigs who already have a bit of respiratory sound a little bit louder,
that
like
makes
noxally.
sense. Yeah.
Like when she's eating, she tends to inhale and do this almost like snoring sound, which we're not really sure what that is. But when she was sleeping yesterday, I could hear it.
That's good to know.
Yeah. So I think
Oh.
it's maybe affecting them a little bit. Hopefully it eases up. We've
Yeah.
already had a heat dome this summer. Hopefully no more, but we still have all of August to get through. So if you're able to
and
donate.
September, it's going to be
Yeah,
hot
don't worry
too,
about September's
probably.
perfect. It's our birthday month.
Yeah, it's the best month.
Best month. Don't worry about that month. I'm gonna pretend there's no heat then.
Precisely.
At least it gets a break. We've had this past month and a half, maybe 3 cooler days.
Yeah,
Like
yeah.
not exaggerating. It's
Yeah.
just been relentless. The mornings are cooler. Sometimes you'll see the pigs out grazing in the morning. Like
Yeah.
they know how to schedule their days.
It's nice
and then
coming
come
in the
after.
morning,
Mhm.
yeah, and they're all out enjoying it while they can. So yeah, but it's brutal.
Elena from Texas.
Oh.
Welcome to Bear Care Corner. We're at the Bear Care Station in the medical suite in the barn. Hi, Sylvia. Thanks for tuning in. The link to the kindness cooler is in the comments if you want to click on that after and get a few cold treats for the residents to get us through the rest of the summer.
Yes.
Okay, so our next update is April. This was the before photo. So she's up in the pig chute during this, and it looks like you just started and you're like waiting to take a picture.
Yeah, exactly. Yeah, so April is also due for a hoof trim. So we brought her from the arena down here to where the chute is. We set up this wonderful little mat walkway for her just to make sure that she can walk over safely.
Turkey is hopefully using later.
Yes, exactly.
If you'll let us.
So April had a couple issues that we were rechecking on her front feet. So I was very shocked to see the back foot looking like this. This is her back right lateral to the outside claw. So I think at this point there was a piece of like jagged hoof on like the front of the hoof that I trimmed off already. Then I looked underneath and there's a lot going on here, like a lot of
mess.
Irregular growth and kind of lumpy where it shouldn't be. Like it's not wearing down properly. It's growing kind of funky. And we do see those sorts of things with the older pigs who are a little bit less active, especially April's family. They kind of like to snooze most of the time, so they're not really wearing down their
She's
hooves.
13 and a half, I think.
Very old. told. Yeah. So when we started digging this out and kind of getting the hoof to look a little bit more normal, we found a dark, stinky pocket. Yeah, so it was quite
kind of that abscess smell.
Yeah, exactly. As soon as we started getting in there, the smell was pretty strong. So we opened it up as much as we could, gave it a good clean. She's already on pain medications, but we started her on antibiotics, oral as well as topical, like an actual little boot soap that kind of helped draw out infection in that hoof as well. And she seems like she's doing well. Like she's definitely not moving any worse than usual, which is good. Yeah, it's not affecting her. So she's had the boot soak for a couple days. Doesn't really seem like it's drawn out anything crazy, which is good. Sometimes, I mean, just trimming it down and opening it up is enough, right?
Yeah, because when that stuff's trapped in there, it can create a lot of pressure and just kind of stew. So now it's open.
Exactly.
Might be good enough.
Yeah. Like a lot of those bacteria that can cause like infections like that, they like brew when there's no access to oxygen, basically. So now that it's all opened up, things seem to be moving in the right direction. But yeah, it was pretty wild when we got to look at that foot.
Found some very funky things this past week. We go through. Sometimes there's moments where you're not really finding anything weird, and this past week has seemed like a lot of
all the things,
weird, gross things. Hi, Helen. Thanks for tuning in. Escalade looks very fashionable in his purple booties.
Oh, he does.
Is he okay with them?
He's
not bothered by them at all.
Yeah. I think Bailey just went to go feed him lunch, probably.
Yep.
But yeah, Bailey got those booties on him when they were in the barn for their hoof trim last week. And yeah, he seemed to do really well. I don't think he was as excited about getting the back booties on, which is why he's only wearing the fronts for now, but that's fine. I mean, he's never worn fly boots before.
It's a huge step for him.
Exactly, yeah. BJ was used to them. He's worn them previous summers because he's very sensitive to fly bites on his legs. Escalade not so much, but we gave it a whirl this year, so Bailey was able to get those on him. He looks very cute.
And they were coming in the barn in a few hours for their appointment tomorrow. We have our vet out doing all of the rabies vaccinations.
It's vaccine day.
It's vaccine day. It'll be, the horses are getting 3 different vaccines, so they're going to be in probably the arena space. All ready to go, and then we have to prep Pouty, so he's ready to go, and everybody else is just going to already be here, like the pigs. Sadie. She's probably there the whole time. I didn't notice. So little. So yeah, it's a big day for our vet visit, and he's also going to be assessing some mobility things with April's herd and some other stuff going on. So yeah,
it'll be a busy day.
They're getting moved. We have a few more movements to do today with them and Pouty. And we have Sage heading to the vet at 3 p.m. So in a few hours.
Yeah, there's a lot going on all the time.
She's looking a bit off this morning. And with birds, if they're looking a bit off, it could mean they're really sick because they hide pain really well.
Yeah.
Hi, Maggie. Thanks for tuning in. Very smoky Tuesday. Hope this clears up for everyone. I feel like a lot of folks are feeling it. It says the air is very smoky in Maine. Jerry Lee said that. So it's kind of all over the place, unfortunately. Okay.
Yeah, hopefully it passes.
One more update on Winifred. We showed a photo of her x-ray yesterday on Barnside, but this one's a different view.
Yeah.
Which view is this?
So this is, I think it's for actual x-ray, Palmer? No.
No pressure, I don't know either.
Dorsal plantar, I think. No, dorsal Palmer. I think it's dorsal Palmer.
There you go. We learned something new today.
Yeah. So from this image, you can like really appreciate the damage on that. So on this image, it's on the right of the image, but it's her front left lateral claw. Yes. Yeah, exactly. So you can see what that normal bone looks like compared to the one that's been broken. It was a pretty traumatic break. So not only is it fractured, but it's also crushed and it's also twisted. And then you can see the faint outline of what her actual foot looks like as well, like the soft tissue of it. And you can see how swollen it all is. Everything's a bit displaced. So we're still waiting to hear back from her kind of like primary vet team at the hospital at OVC. But basically it might end up looking like a couple more months of stall rest for her, unfortunately, just while we're waiting for that joint to kind of fully fuse. And kind of do its best to heal itself. We're getting there, but not quite yet. Yeah, poor girl.
Take Rads again in another 2 months or so.
Yeah.
So she's doing well on Star Rush, and she has this whole time, which we're really happy about.
Yeah.
Pigs being separated from their herd in a different environment. She's in a small space as well. We were really concerned about her mental well-being.
Definitely,
during that time.
yeah.
Social activities, like that's so huge for pigs. So being separated from all of that, we were really concerned. She's actually doing surprisingly well.
I'm so thankful every day. I think about like how bad this could have gone with her being on stall.
I don't know how to say your name. I'm sorry if I say it wrong. Salikul from, I know you're from Thailand because I've seen you on here before, so welcome.
Hello.
It's 1:20 a.m. there, I think.
Whoa, thank you. That's really dedicated.
Yeah,
Incredible.
saw your name pop up there.
Amazing. But yeah, Winnie's doing very well on stall rest, so we'll get some retake some images in a couple months, and hopefully things continue to go well for her. But she's in good spirits.
Yeah, and there's like you said, there had to be some remodeling happening in there. I think there has been some. Like
there definitely has been. Yeah, there definitely has been. So
the body's working on it.
Exactly.
We're gonna be adding more supplements. So got her on like glucosamine and just things that will help her body heal as much as possible, because you can't tell her to rest in bed 8 hours a day or stay off her foot. She is
she's compensating
lateral.
Yeah.
So she's holding herself a little bit more on the medial, which is the middle toe. They have 2 toes in the front there. So she's compensating, which is good. And there's no specific lameness, but she kind of just goes from like 2 little stalls back and forth every day. I don't know if it would be appropriate to like walk her down the hall to assess, because I don't want her to injure herself anymore.
Exactly. Yeah, it might not be worth the risk, unfortunately.
Yeah, so keeping her quiet, and she's been getting like forage buckets. We go out and pick her grass.
Yeah,
and grapevines are starting to come out. Everything's very like lush
everywhere.
Right now.
Yeah,
even the leaves are starting to turn a bit. It feels weird when it's so hot out, but
I know.
Yeah, there's a lot. There's an apple tree on the.
There were apples on the driveway this morning.
Little green apples, and they're not too bad. They're not too sour. Usually those little apples are sour, and I ate one.
Awesome. I might take some on my way home. Yeah, I saw them
to show your dad.
Yeah.
So we realized we have an apple tree on the property, and
Very
there's
exciting.
Cherry trees, which are done for the season. There's all kinds of things around, and I don't know how I got on this topic. I just like talking about trees and stuff.
It's just fun, like discovering all the new
Don't
stuff.
get us start us on jumping spiders or
Yeah.
anything like that. Like we're done.
Yeah, there's a lot of exciting stuff here.
Yeah, and just and being here, not even for a full year. Seeing everything's developing.
Through the seasons. Exactly.
And everything's been pretty good even during the heat wave. Only during the heat dome that we have issues in the arena being too hot.
Do you want to come back? Yes, I can. Just one more time.
Oh my gosh, she's coming.
She's purring. She's purring. She just looks like a baby. Was she like a year and a half?
Oh gosh, I think so. But she was just born. That doesn't make any sense.
Just a little, like, was she 6.5 pounds?
Yeah.
Sending some love to Pouty.
Oh.
Well, he's going to get extra love. I don't know if you were here at the beginning, because I didn't see your name pop up until now. You want to go down? She's using my back as a staircase. Hang on.
Thinking about it. Oh, wow. Oh, she got it.
Pouty is having his vaccinations tomorrow, so we're getting him prepped now by putting him in a little area, so he's ready for the vet.
Yes. He'll be very brave, I'm sure.
Give him extra kisses for
Yes.
you. One last photo. This is not a resident update. It's just because we're obsessed with Raymond, but Nicole took this.
Yeah.
And you can kind of see, it's kind of like an update on his teeth, because you can see at the front there's usually, 4 of those?
Yeah, the little
incisors.
Incisors, yep.
He just has a 2, and now his tongue's filling in the space where the other 2 were taken out.
Yeah, literally where that extraction site was. His tongue is filling the spot.
Super cute. He's due for a test trim.
Yeah, looking at this photo, I couldn't really tell before, but
how did we do his last test trim?
The belly rub.
It was me and Chris, and I was like, Chris, I have to try this, and he's like,
because we always talk about it. We're like, I think we could do it.
We're like, we think he's a candidate for a belly rub test trim. Normally we do a snare, and it's really quick. This took way longer, but he just lay there the whole time. He did a few, I don't love that. And I had to do a few cuts. Like, I did the tip of it, and then went down further. I didn't do one big, so you have to really pull the surgical wire, really hard and quickly. So just to get him used to that feeling, and maybe we'll try it again.
Yeah, because we do all of the tusk trimming, like Andrea said, with the snares, and it's very, very quick. However, Raymond
that's true. I forgot about that part. I was like, it's just Ray. There's a reason.
Yeah, he is a bit dramatic, and I mean, over the years,
the worst.
Yeah, over the years, we've really perfected our method and our protocols for tusk trimming. But he is very big. He loves alligator rolling. controlling, and
he loves doing dangerous things.
He loves
while being
doing
snared.
Exactly. He loves doing dangerous things. And for his safety and for ours, we've started to kind of explore different ways of trimming his tusks. So initially we were going to try like a sniff of injectable sedation, which of course like has its risks as well. Well, really more of like a gentle tranquilizer.
Yeah,
like,
this one specifically, if we were administering it, would be like just a little.
Yeah, it wouldn't be like
little anxiety relief versus like he's sedated
fully
out.
Exactly.
His last sedation. Well, his sedation during his teeth removal was fine, but we did one on site that he
was a little bit dicey.
Was dramatic about.
Yeah. So we were potentially gonna move to that sedation, but kind of as like a last ditch effort, we were like, okay, let's try it with the belly rub.
And I wanted to try, and I tried Herky once, and he didn't like it.
Yeah.
It is a weird feeling, but
probably tickles.
Yeah,
feels
just
kind of
vibrates
a bit. Yeah.
But yeah, the tusks don't have any like nerve endings; they just continuously grow. So we were able to cut them, and we cut them to keep everyone safe. If he does a really quick bite at someone because he wants them out of their way, it's not even aggression usually with each other. It's just like, I want that bowl of food.
Big,
there's a watermelon. They
toss
them around. That's how they communicate with each other.
Yeah.
They can accidentally cut each other, and those tend to be really sharp depending on if they have an overbite or underbite or how their jaw is aligned. Some of them don't, like Herky. They don't really line up, so they don't sharpen on each other.
They just get really long.
They're like self-sharpening. I don't know how to.
Yeah, they're like scissors.
As they chew, and they become
yeah.
scissors, and they become really sharp. And
Sadie, we're distracted by Sadie.
Bailey's back from rounds. Bailey did rounds. Bailey did midday meds, and now we're going to try to get Herky in the chute and move some large resonance around.
Yep,
a big day of movements.
Yes.
And Bailey's going to do some injections later.
Yeah, I might start.
She's giving a thumbs up.
Yeah, I might start some vaccines.
We do our own vaccines minus the rabies.
Yes.
Ontario government needs to have that very regulated, which
is
great.
Yes.
Thanks for tuning in, everyone. Thanks for tuning in from all over the world, including Thailand.
Amazing.
It's been wonderful to spend time with you all here, and we will see you again next week.
Thank you.
Bye.
Bye.